The Delta Primary Stroke Center at Greenwood Leflore Hospital is the only Level 2 stroke program in the Delta region.
The patients are usually seen in the emergency department first and then are sent to RICU for further monitoring. Sometimes if they are able to make it to the intensive care unit and the ER within the 3 to 4.5 hours after having a stroke, they'll receive a clot busting medication if it's an ischemic stroke or a stroke with a blood clot. When that happens, they start the medications downstairs and then we'll finish the medications with us in the intensive care unit. We will monitor the patients every 1 hour, and the neurologist and the neurosurgeon will come evaluate the patients. On the second day of the patient being there, we will start therapies like physical therapy, speech therapy, and occupational therapy to further help the patient move along through the stroke process.
Our community here in the Delta have very high-risk patients for strokes. There is no stroke program except for us in the Delta region. The closest is Jackson or Memphis.
The staff and the nurses and the doctors were all fine. They treated me real well, and I had a strong relationship with my doctor and stuff, and so things worked out pretty good with me so far.
We're so grateful for Greenwood Leflore Hospital and Leflore Rehab. I mean, it has been a tremendous help to our family. Even with his grandkids, you know, seeing him down, we were all kind of worried, but I mean, with courage, it takes a lot of courage to be willing, and he was willing, and for that, we're also grateful.
I thank God, my family, and Greenwood Leflore Hospital for bringing me back from the stroke.
Stroke is basically a disruption of the blood supply in the brain due to any reason. If it is due to a blockage of an artery, then it is called an ischemic stroke. If it is due to a bleeding in an artery, it is called a hemorrhagic stroke. Stroke is the 5th leading cause of death in the United States. However, it was 4th before this, but now it is 5th. And it is the single most cause for long-term disability in this country.
The doctor said I would make a complete recovery, and I believe every word he said. And those people up at rehab, oh man, they the best in the world.
Having our stroke program allows our community to have stroke treatment at their access 24/7, much quicker and much closer.